The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome to the Women in Depth podcast. I'm your host, Dr. Lourdes Viado. Join me as we explore the inner lives of women, their struggles, fears, hopes, and dreams. We'll go beneath the surface and take a deeper look at what is hidden, unknown, uncertain, and uncomfortable. Hi, Carmen. I'm so happy that you're here today and excited about our conversation about complex trauma and highly sensitive persons. So thank you for joining me as we kind of do a deep dive into this area.
Yeah, I'm really excited. I think it'll be a good discussion.
Yeah, and I know that, as we have worked together in a previous episode and just in the clients that we serve, we're just, as we were talking, we were realizing that there are some aspects of complex trauma and high sensitivity that can make it really hard for the average person or even a therapist to really be clear on what is happening with this individual.
Yeah, I think there can be a lot of things that make it confusing to understand and differentiate.
Yeah, and so I think that today for our listeners, this will be really helpful for you in terms of maybe getting more clarity or an understanding of what you're experiencing, maybe even an idea of a direction to move in, and if anything, at least helping you to feel somewhat reassured that whatever you're experiencing, there's a name for it, there's support for it, and it's not that there's something just wrong with you or you're going crazy, which are all things I've heard from clients when they've grappled with this, whether they're dealing just with high sensitivity and trauma, or just trauma. So this is confusing.
Yeah, I hear very similar things.
So today, what Carmen and I are going to be doing is just really having a conversation between two therapists who are also highly sensitive, who are passionate about working with individuals with this trait, and especially in supporting those who are healing from trauma. And so today, this conversation will be a little bit different from what many of you have heard on the podcast. This isn't really an interview style. This is Carmen and I having a conversation that we hope will be helpful to you as you are listening in. So today, the whole purpose of our conversation is we want to make more clear what complex trauma is, how it's different from PTSD, post-traumatic stress disorder, and why this can be confusing and difficult. And then hopefully from there, this will be a good starting point for you to have a better understanding of perhaps what you're dealing with and how to move forward. Carmen, what are some of the things that you have noticed when it comes to just confusion about complex trauma and PTSD?
Complex trauma tends to be harder to recognize, and a lot of my clients don't even realize that they have been through trauma because it looks different than general PTSD. Have you seen that as well?
Yes, absolutely. It's almost as if first there's the dealing with the understanding that there's a thing called high sensitivity and that they have the trait. Mm-hmm. That's the first part of it.
Yes.
And then with that, of course, comes the relief and some sense of feeling better because they are at least able to maybe make some lifestyle changes that help manage the trait a little bit more.
Yeah.
And then after that, when we bring in the complex trauma piece, there's usually some disbelief, like they're not really sure if I'm on the right track here, which is fine. Yes. It's okay. I can be wrong. And then also, again, the shock and then some relief about perhaps this is what's going on with me, but then what does it mean if that's what's going on with me?
Yeah, I think I agree that sometimes there's a bit of shock and like maybe not believing it, but other times, or in addition to, also almost feeling validated. I'm not sure if that's the right word, but almost like, oh, it's making sense now.
Yes.
Because when I do a lot of education in my work with clients about trauma, and when we start to go into that, it's actually pretty grounding for them. And because they're like, oh my gosh, the pieces are coming together. And now I understand part of why I react the way I do, or why I have difficulties in these areas of my life. And it starts to just kind of make a clearer picture for them about their experiences.
Yes, that's absolutely correct. I've heard that also from clients, a sense of relief that there's a name for what I'm experiencing, and there's, other people are dealing with this, and it's not just something's just wrong with me that nobody understands, or it's just me, whatever they've told themselves. And so, I agree with you about that, about the sense of validation. Again, at least, if you know what you're dealing with, you also know how to move forward.
Exactly. I think that that's what's also important about this topic, is because if someone doesn't know what they're dealing with or what's going on, it's really hard to treat or to heal from some things, at least when it comes to trauma, or even with HSP, like knowing how to manage that.
Yeah.
And so you might be addressing one thing, but that's not actually what's going on. So it's going to be hard to, like you said, move forward or heal.
And I think, again, like what you said about, since you know what is happening within you, you're able to move forward. And I think this goes back to our why we're having this conversation. When misdiagnosis happens and you're not receiving the right treatment for what you're dealing with, that can actually result in someone feeling more shame, more confusion, more
misunderstood.
More misunderstood, yes. Or the sense of, this isn't working for me, but this works for other people. Yeah. So we're going to start off with talking about what is complex trauma. I'm going to invite Carmen to start, and then I'll jump in.
Yeah. So usually with complex trauma, it relates more to like an ongoing experience, like an exposure over time of something, usually when there's not like an end point to the experience. And this is often in childhood, early on, and that can be physical or emotional abuse or neglect from a caregiver. Or I often see it, at least in my work with clients, I see it more with their experiences in early relationships with their caregivers, which are sometimes parents and sometimes other adults. And that's usually what I work most with and how it shows up most in my clients.
Yeah, and I think too, what's important about this is often we have this idea that in order for my childhood to be traumatic, I needed to be physically abused.
Yeah.
I needed to have experienced sexual trauma. And we have this idea that that's trauma.
Yeah.
And actually, trauma can be a well-meaning parent who is there all the time. The child is not being hurt in any way, but maybe, mom or dad is dealing with their own mental health issue. Maybe they're dealing with their own depression. Or it can be a single parent home where mom is just having to work 3 jobs. And so this child grows up with a lot of time by him or herself and not really having a parent who's able to respond to them emotionally or really be engaged with them because they're working. It's legitimate. They're doing the best they can. And that's hard to see as trauma for many people.
Yeah. I think that is what often makes it harder to distinguish or recognizable, and people totally miss it. For example, I have clients, when I ask them about their childhood, they're like, oh, my parents were great. They were supportive. And then when we go a bit deeper, it turns out they were emotionally neglectful, right? They were, like you said, they might not have been emotionally available to them, whether they're not physically there because they had to work a lot, either, they're a single parent and they have to help their family survive, or in other ways, like you said, they're dealing with their own mental health stuff, so they're not emotionally present. So, a client might be like, oh, they showed up to my sports games, or they provided me with the things that I wanted and needed. But then when I asked them, like, well, who did you go to when you were upset or you're hurt or you had a problem? And they would be like, well, no one. I just dealt with it myself.
Yeah.
Either they maybe stuffed it down or ignored it, or they found some other way to cope with it. So their parents might have been able to like physically meet their needs, but those emotional needs might have not have been met.
And I think another way that this complex trauma shows up, I see a lot of this, is a child who had to grow up too fast. You know, in the therapy world, we have a term for this, which is being parentified, which the child becomes like a parent and may, in fact, in some way feel concern for or feel responsible for taking care of their parent. And that's also very confusing because there's a sense of pride and care to look after their parent, and the parent may be dealing with a lot of stress, their own physical or mental illness, with financial issues. And so the child doesn't want to burden the parent, doesn't want to stress the parent out. And so what they do is they keep everything to themselves and they cope with everything alone. And that's also what I see with complex trauma.
Yes, absolutely.
And then the other thing I wanted to mention is the ACEs study. And for our listeners, ACE is an acronym for Adverse Childhood Experiences. And this was a study that was done, I think, in the late 90s. And what they did in the study is they looked at experiences in childhood that result in health issues for the individual, among other things, later on in life. And some of the adverse childhood experiences that are in the study are, some are physical abuse, verbal abuse, sexual abuse, physical and emotional neglect. So some of the things that we think of with trauma, although I think emotional neglect is not really considered trauma by the average person.
Agreed.
Yeah. And then the other experiences are, a parent who is dealing with substance abuse or an addiction, a mother who is a victim of domestic violence, family member in jail. Carmen, you and I were just talking about when there's a family member with a mental illness. And I think this is really critical. The disappearance or absence of a parent through divorce, death, or abandonment. And I think that disappearance or abandonment is also what we're touching upon when we say the parent's there but not there.
Yeah.
So when we're talking about complex trauma, these types of experiences that are ongoing, if you have a parent who is having to work 3 jobs and is not able to be emotionally attuned to their child, and this is what the child grows up with, this is ongoing. And with complex trauma, there are also layers.
Definitely.
So that might be the foundational piece of it, that mom is having to be at work all the time. But then on top of that, now maybe this means that the child is taking care of their siblings. So they have that responsibility. They're dealing with bullying by themselves. All kinds of things that also play into other experiences that just layer on top of the parent not being present.
Yeah, because they also might be less safe in some ways too, with the parent supervision not being there. What other kinds of situations might they get into that could be dangerous or create other problems?
Absolutely. Yeah. For those who are listening and you're interested in this study, which, by the way, this is a study that has been replicated in different states with different groups. There's a ton of research on it starting when it was first done in the late 90s up till now. You can go to the aces2high.com website and it'll have the original study there along with a way for you to evaluate your own score of adverse childhood experiences. And it's just a good starting point to get an understanding of what is complex trauma and have I experienced it. Another resource I just thought of, Carmen, is Dr. Jonice Webb's work on childhood emotional neglect.
Yes, she has some great material on emotional neglect. She has a couple books. I believe she has sort of a questionnaire.
Yes, she does. And so what we'll do for our listeners is we'll put a link to the ACEs information in our show notes along with links to Dr. Webb's books. And Dr. Webb has been on the podcast, I want to say 2 times, maybe it's 3 times.
Yeah, I think I've heard hers.
And we'll make sure we also link those in the show notes because I think what Dr. Webb does a beautiful job of bringing to our attention and understanding is how emotional neglect significantly impacts a child's life. Since we've talked a little bit now about what is complex trauma, we're now going to talk about what is PTSD or post-traumatic stress disorder. And this is one that we've heard about a lot, especially in terms of veterans, the military, first responders, events that are traumatic, natural disaster type events. PTSD also, one way it's different from complex trauma is post-traumatic stress disorder is actually in the DSM-5, which for our listeners, this is what is it?
It's like our manual that a therapist would use to diagnose.
Yes.
Like it lays out the criteria for diagnoses so we can say, oh, this person meets this diagnosis for these reasons.
And it's also what insurance companies require to pay for your insurance if you are seeing a therapist who works with insurance panels.
Yeah, because you have to submit the diagnosis in order for them to cover the sessions.
And so I think that's also another reason why complex trauma can be missed or misdiagnosed or dismissed, is because it's actually not in the DSM-5.
Yeah, so I think there are other medical manuals that allow for that diagnoses, but a lot of people who are seeing those with complex trauma are therapists, and in our diagnostic manual that we use, it does not include it, which is unfortunate because I see it frequently.
Absolutely.
But I think, like you were saying, the general PTSD is what most people are more familiar with. Like you were saying, veterans, and there's more exposure to that, I think, generally in our society, where people generally recognize the acronym and know what that might mean, but not as much the complex trauma. And the symptoms are different. Like you were in reference to that diagnostic manual, what symptoms they're saying, these are the symptoms that display when someone has PTSD. So a lot of those things look different than complex trauma. And there are definitely some overlaps.
Yeah.
Should say that. But it just shows up in different ways and is easier to pinpoint because it's usually like more of a one-time incident, and is more maybe related to often like sense of safety in the world. And that's a big piece of it, I think. But people can often, when they're dealing with general PTSD, a lot of times people would describe kind of feeling like raw or on edge, like exposed sort of. That's something I hear frequently, like, oh, I just feel really raw. Like everything coming at me is just too much and overwhelming. And then they often will be reacting emotionally like beyond what would be typical of a situation because they're triggered. Like it's not, they're maybe getting a reminder of their traumatic experience. And so often that also can lead to avoidance, which is another way that shows up, where they're not, they might be avoiding places or people or things that remind them of the trauma, or they might be avoiding through disconnecting from things or numbing out, like substance use, or kind of checking out a little bit and not feeling so connected to their environment or to their body. And again, some of these things do show up in complex trauma as well, but they might show up in different ways too.
And I think also with one of the things with post-traumatic stress disorder is you're usually able to connect it to an event.
Yes.
There's another diagnosis, I think it's ASD, acute stress disorder. This is what happens within the first 30 days after a traumatic event. And PTSD continues that beyond those 30 days. So 6 months after an event, a year after an event, you are still experiencing these symptoms of avoidance, numbing, feeling on edge or raw, difficulty focusing, concentrating in areas of your life. But I think what's significant about PTSD is, again, when you ask the question, when did you start feeling this way? When did you start struggling with your attention? When did you start having a hard time falling asleep or having nightmares? Usually with PTSD, an individual is able to say, well, this all started after this.
Yes, it's like very easy to pinpoint. Oftentimes people know what it's connected to.
Yes, they know.
Of like, oh, I went through this thing and I'm still feeling this way, but it's over. So why am I still feeling like this?
Right. And I think, too, another aspect of the difficulty in diagnosing complex trauma is that often someone will experience a traumatic event. Maybe they are in a horrible natural disaster or car accident, and they go in for treatment or not, but this is happening on top of undiagnosed complex trauma.
Yes, I see that so frequently. That's usually why someone comes to see me, because they already identify having experienced trauma, but it has now escalated.
Yes.
yes, they are dealing with general PTSD because these symptoms are all showing up, but then it's exacerbated these other symptoms or experiences. It's bringing up the old trauma.
Yeah.
So frequently, and they don't usually know it until we start, like I'm getting to know them and getting a sense of their background. And it's like, oh, wait, there's these other things that may also be contributing. And so it feels even more intense.
I'll just share some examples so our listeners can kind of see what this could look like. I work with a lot of first responders, and because of that, obviously through their work, they're showing up because of something that happened at work that was very traumatizing, an event where they experienced or witnessed a physical threat to their own or somebody else's safety. So this could be like seeing someone who is killed, surviving a car accident, surviving a hurricane, anything like that. So they come in for that, but then as we start to work on that trauma, as the conversation continues, then it comes out that there's also emotional neglect or some kind of bullying or abuse or absence of parents when they were younger, or someone coming in because they've experienced some kind of sexual assault. But really, yes, the sexual assault is a very significant, serious trauma. However, there was already complex trauma before that. So this, again, just makes the work more complicated.
Yes.
And I think that's also why there can be a struggle with the diagnosis of PTSD, because it doesn't really quite fit what the person's experiencing.
Mm-hmm. Yeah, it's going to show up a bit differently in their life.
So for highly sensitive individuals, there's a term called Vantage Sensitivity. And what it means is that because of the depth of processing, because of the intensity that HSPs, highly sensitive persons, feel and perceive the world and how they take in information, the experience of trauma is really just amplified.
Yeah, they're even more impacted by that. And I think about that too with complex trauma and the emotional neglect we were talking about, because I think a lot of times HSPs already feel either misunderstood or that their feelings are too big or their parents maybe don't know how to manage their big feelings because their feelings are really strong, especially as a child when there's less of those filters, right? Where they're just expressing them in various ways, and a parent might not know how to manage that. And so a child might learn to, if they don't have the tools to soothe themselves, they're going to find whatever way they can to manage it, which, as I said, sometimes leads to like kind of ignoring their own feelings.
Mm-hmm. Or even like perceiving themselves as being, I'm too much, because they've been told that they're too dramatic.
That's so common.
Right, that you're a drama queen or a drama king, or, oh my gosh, everything is too much for you. You're just, then what happens is with the feelings that becomes, it's not trauma. It's just, I'm too much. And I make a big deal of things. So that misunderstanding the trait and how whatever it is, whether it's complex trauma or PTSD, can get lost in that or buried in that.
Yes, absolutely.
And I think too that because of the emotional intensity, HSPs can present or can look very dysregulated.
Yeah. They might have a harder time being able to regulate their emotions, especially if they haven't been given the tools to do so.
Yeah. And I think then again, it becomes about, you need to learn how to calm down. You need to learn how to manage your anger, that you don't have any coping skills, all the things that they are told, that they're kind of all over the place, and not understanding that with the emotional intensity and depth of processing, we are seeing the trait. And it's hard for many to see beyond that. I've had clients that were actually diagnosed with bipolar and put on medication.
Yeah.
And felt a lot of shame about their intense emotional outbursts, where they would just be out of control, scary to themselves and to the people around them, and just thinking something is wrong with me, not realizing that this is that depth of processing, the emotional intensity, this very finely tuned nervous system that doesn't know how to calm down. It's not getting the support and what it needs to do that.
Yeah, and so it can look like those mood swings or like highs and lows of bipolar sometimes. Yeah, I've had clients as well have that diagnosis, which may or may not fit, but sometimes it's being misdiagnosed because someone is not familiar with either high sensitivity, complex trauma, or both.
Yeah. And I think too, this can also show up as just extreme severe anxiety, generalized anxiety disorder. And if
yes, I think a lot of times that's very, very present.
Yes. And I think too, with the trait, highly sensitive individuals are very tuned into what they're feeling physically, and their feelings can show up as an upset stomach, a headache, nausea, all of the physical expressions of symptoms. And again, this can be looked at as simply medical issues, or that they need to get more sleep, or they're having too much sugar.
Yeah.
Which, of course, all those things do play in.
Yes. And because they can be more sensitive to things too, like caffeine or alcohol or other, and medications too. And that's probably part of why when people are being medicated for things, but that's not actually what's going on, it's not going to help.
Yeah. And Carmen, can you speak a little bit about, because we've talked about some of the misdiagnosis, about when someone, the misdiagnosis is really about not catching all the diagnosis, that there's other things going on, that maybe one diagnosis is correct, but there are other things in addition to what is showing up.
Yeah, sometimes there can be overlaps where it could either be the highly sensitive traits going on, it could be the complex trauma, it could be the combination of those things. And sometimes other diagnoses might be in addition to that, or it could be just something to take into consideration when trying to understand a diagnosis, because there can just be symptoms that look like the traits of high sensitivity or similar symptoms to complex trauma. But all of those things in combination just can make it a little bit harder to distinguish. That's also why it can be helpful to find a provider, whether that's a doctor or a therapist or, psychiatrist, that is knowledgeable about HSPs and complex trauma, because they can help. If they know about those things, they can help sort through some of that sometimes because of some of either the overlaps or what can look like one thing might actually be something else.
Yeah. And one, you just reminded me of one situation. Well, actually, it's not just one. This has shown up in different ways where an individual has experienced some type of bullying or trauma in a relationship, and now they think that they're dealing with social anxiety.
Yeah.
And really what has happened is there's a trauma around relationships and in their social circle. And then you combine the traits of high sensitivity, and it does really look like social anxiety, but there's anxiety around these trauma reminders where the trauma is activated.
Yeah. So they're anxious. There's like avoidance around these social interactions, and they think it's social anxiety when really the avoidance is they're trying to not get triggered.
Yes. There are so many nuances when it comes to diagnosing complex trauma for the highly sensitive person. And it's so easy for this to go wrong, especially when either the individual and the therapist, or either both or one, or even just one, isn't aware of the trait of high sensitivity. And one of the things that I love about working with clients who have experienced the complex trauma is that if we can get clear that this is a highly sensitive person, if we can at least establish that, there are things that we can do to make changes in their lifestyle and teaching them about how to calm their nervous system. And then you're able to really get to the trauma.
Yeah. That emotional regulation, or like coping with those emotions that can be kind of extreme almost.
Yeah.
I think that's a big piece of helping people feel a little more like grounded and centered so that they can manage things better.
Yeah. And I also wanted to share for our listeners that they've found that it's either, I think is it 50 or 40%? And Carmen, maybe you can help me with this, of the clients in therapy are highly sensitive. I mean, it's a pretty high number.
Yeah, I believe you're correct in that.
Yeah. And so, for therapists who are listening, if you haven't looked at your clients and gotten a sense of who may or may not be highly sensitive, this is something that is just going to be really valuable to you if you're able to identify which clients are highly sensitive. And if you're a therapist, at least 40% of your clients are. And I've found this to be true for myself. Anywhere between 40 to 50% of my clients are highly sensitive. And this was before I started to focus on only highly sensitive clients.
Mm-hmm. Yeah, same as me. And then my clients now are probably more than that simply because it's a specialty. So they find me easier.
Yeah. And so it's worth exploring if you are someone who is highly sensitive in therapy to seek out support in integrating the trait into your therapy if your therapist is already not familiar with it. And if you are a therapist, it will really enhance and help your clients if you're able to bring this awareness of high sensitivity, if you can use this as part of the lens that you are looking at when you are trying to understand and support your client's healing.
Yeah, I agree. Especially because a highly sensitive person often, I think I referenced this before, can feel misunderstood. Yeah. And it can be so important in the therapy relationship to feel understood. And so either to find a provider that's familiar, or if you are a therapist, to understand it so that you can understand how these folks might be showing up differently than other clients, and that you can understand them and validate some of their experiences.
So we hope that today's conversation has perhaps shed some light on what you're experiencing and maybe can help you move in a direction so that you can find the support that you need. We are going to put links in the show notes to the different sources that we mentioned. And I also want to invite you, if there are topics or areas related to complex trauma and high sensitivity that you would like us to possibly explore in a future episode, feel free to email and send your questions in, because this is an area that Carmen and I are really passionate about and wanting to provide meaningful information that you can take with you and is helpful for you as you move forward. So we welcome your ideas and your questions, and thank you so much for listening.
Thank you.
Thanks so much for listening to the Women in Depth podcast. I hope it brings you a deeper understanding of yourself and others, and that you found some insights that illuminated and inspired. If you like what you hear, please consider supporting Women in Depth with a one-time or recurring donation. Any amount is appreciated and helps us continue to provide free, quality content for the world. If donating resonates with you, you can find the donation link on today's show notes. You can also follow Women in Depth on Facebook and YouTube, and if you haven't yet, please subscribe on iTunes. Again, thank you so much for listening, and see you next time.